Hi,
Okay.
my name is Ashok Bhattacharya, and I'm living in Toronto, Canada. And I'm so happy to be speaking to Minky van der Walt. Did I say that properly?
Yeah.
Yeah. How are you doing today?
I'm really excited to be here actually. So I'm coming to you from Nipaluna, Hobart in Lutruwita, Tasmania, which is a little island right at the bottom of Australia.
Amazing.
Mm.
Now, we're on opposite ends of the world, but we have a lot of connections, actually. I think we're both musicians and we're
Yep.
both we're both psychotherapists.
Hmm.
And hopefully we're going to be meeting each other in July next year at the conference. So I'm really excited to meet everybody there and talk about shared ideas on how we came to what we're doing and how we can collaborate even more with what we're doing with each other. Tell me how you came to what you're doing.
Well, just thinking where to start. There's the music journey, there's the therapy journey, and then there's coming to here. So, I mean, I've always been a musician and originally started a music degree at the University of Melbourne and then transferred over to music therapy degree. And then through many wanderings through my career, culminated with in the last sort of 15 years or so working as a child and family trauma therapist. And I think through the work that I did in that area as a therapist, as an advocate and a trainer, um, really witnessed and experienced the distress of the people supporting the children and families in distress, and just through that experience became really passionate about supporting clinicians, therapists, service providers to reconnect with themselves and their experience so that they can have sustainable careers and thriving personal lives. So that's a short summary of how I got here.
So would you say that you're particularly keen on helping the helpers?
Yeah, yeah, that's definitely part of my focus.
That's such an interested and overlooked area, I find, especially in healthcare. I've been
Hmm.
involved in healthcare since the 70s, actually. I used to be a nurse at a psychiatric hospital. And then I ended up getting to medicine, finished that, and then said, well, I think there's more for me. So I got into psychiatry and graduated in that. But the missing piece for me all along was empathy. I thought, become a doctor, they're going to train you in empathy. Not so much. You become a psychiatrist, they're definitely going to train you in empathy. Not so much. So as soon as I graduated, I opened up the empathy clinic, which is my practice. And I came into psychiatry right when Prozac was hitting North America. And so the whole um, kind of zeitgeist went from being a mind science to a brain science.
Hmm.
And we lost the narrative. There was no longer an emphasis on sitting with a person and saying, tell me your story. What is your story? Because where you are now is at least in part, I hope you'll agree with me, at least in part because of your story
Oh,
and all the things.
absolutely.
And I think there's so much to somebody's story. But when we sit with somebody especially in an empathic space, they get a chance to look at their story from an outside perspective and then perhaps begin to rewrite it
Mm.
from a perspective that is less shame-based, less trauma-based, less self-definitional. Because I look at PTSD, let alone complex PTSD, as an event that changes someone's description of who they are,
Mm.
often in a negative way.
Hmm.
And so when someone's come to us, okay, so how do you see yourself? Okay, can we work on that? Is there flexibility in those areas? And if I can just quickly talk about my musical journey. So I bugged my parents desperately for a guitar ever since I was about 12, and they never got me one. They bought my
Mm.
sister a guitar that I had to sneak into her room and play it. But eventually, when I was 15, I got a scholarship and I bought a bass guitar. And after that, I started playing electric guitar and I played in bands and that kind of thing. But what was fascinating to me is that you can play music anywhere and people can relate,
Mm.
irrespective of who they are, where they're from, or what language they speak. So it's kind of like this big empathizer. Then I realized we invented music before we invented language.
Yeah.
Music was the first conversation we had. whether
Mm,
it's banging rocks together or making utterances with our voice, mostly vowels. And then people started connecting and then harmonizing. So that is so powerful. So I've
mm,
always seen music as a therapeutic experience that is profoundly empathic because we can all have some kind of connection to sound, music. We used to have a deaf guy come to our band and he would point to the bass player and says, I feel you, I feel you. And that's he was able to dance. So it's the feelings that these things can cause in us, I think, that can create that connection.
mm. So music's our first language, but it's our first experience in many ways as well, in terms of hearing the sounds in the womb, experiencing the sounds in the room, and it's been with us always.
It's never not
It's
been
been
with
with
us.
it's us individually always, but it's been with us culturally and evolution in an evolutionary sense always as well.
I think so. So when I got into medicine, I was trying to figure out how I had to hide the fact I was playing in a rock band, by the way,
Why
because
is
there was a
that?
bit of oh, because when you become a doctor, you don't have a time for anything else. And if
Mm,
people found out I was also playing in a rock band, he'd be like, "What are you doing? You're supposed to be a
mm,
doctor. So, what are you, a musician or a doctor?" Well, it's like you had to decide. And I think, why would you have to decide? We've got two hemispheres. That one
mm,
helps us with music, and the other one helps us with math, kind of roughly. I know there's science that says that's not quite true, but the idea of getting your whole mind, your whole brain, your whole soul getting involved. And didn't hear the word soul once in medical school or psychiatry. And I think that, and I'd be very interested in your opinion about that, is that I'm interested in the soul and the
mm.
whole.
Yeah. Can I ask you when you finished your training?
I graduated in 1989, so I've been a
Okay.
psychiatrist since 29.
Yeah, okay. And in terms of the loss of the narrative of the story that you were talking about, but do you think that's gotten worse or is it shifting, say in the last 5 to 10 years?
It's gotten worse for trainees in psychiatry because the thrust has become really brain focused, especially with new brain-based treatments. I'm not against it. It's
Mm,
just not. It's just not my. It doesn't align with me as a human being so much. And
mm-hmm,
so the training programs are much more focused on problem solving, diagnoses, DSM diagnoses, that is, rather than who is this person, what's their narrative, and how does their disease fit into the whole person, and how's that affecting them in that way.
mm, mm-hmm.
And that's just not
Yeah,
being
so we
trained.
need we need we need both, don't we? We need that side of things and we need I loved what you said earlier about when somebody comes into your room, you say, what's the story that you now know about yourself? How do you see yourself? Or, that kind of idea. Um, it's really tapping into that person's direct experience. Mm,
Absolutely.
mm,
Because who somebody is so much more than the problem they've come in with.
mm,
It's their entire life. It's all
mm,
of their memories, it's all of their experiences, all of their wishes, all of their dreams, all smushed together in that moment when you're sitting with somebody. And they don't have time to tell you all of that, but you can, like going into a buffet, you can sample and sample and sample. And the more you get to know them, like you don't need to eat the whole buffet, but you get a sense. And just going back to empathy, and I hope we have a quick chat about that, is that when someone feels you're actually empathizing with them, you can see it makes a difference.
mm, mm. That moment of connection and attunement.
Attunement, right? Already we're talking about music, right?
Yeah. I mean, that's what music does so well. It can just tap right in to the experience when there are no words to be able to, well, articulate, but even know what it is that is happening for you sometimes.
Well, I always say that when I am with a client, for example, my main objective is to hold space with them.
Mm-hmm.
I'm too focused on fixing them or fixing their problems and hurrying them up with hurry up, what's the problem? I'm not holding space with them. And I've noticed time and time and time again how powerful it is to have the patience to just
Mm.
sit with someone and hold space with them.
Mm. Well, if you're not doing that, you're not present. And if you're not present, you can't hear what their story is for themselves.
Exactly.
Yeah.
Exactly. And
Mm.
I've often thought of having music in my sessions, and I actually thought against it because I'm so focused on music. I'd be listening to that and not what my clients saying. But I think sometimes we have music in the backgrounds, like in waiting rooms and those kind of places, because it it encouraged that parasympathetic connection rather than that kind of sympathetic overdrive.
So I wonder what's led you to this path of, if we think about the Heart of Medicine conference next year, what's your main interest in being there?
Well, it's part selfless and part selfish.
Mm-hmm.
I think that I've got on LinkedIn because of the pandemic. I had no interest in being on social media ever. Just thought
Mm.
it was kind of fluffy and not for me. Dead wrong about that. And in my travels, I somehow connected with Shari Johnson. And then she said, "Oh, we're having a book club. You have any interest?" I said, "Yeah, absolutely." And so I was involved in the book club for a while. And then she said, "Oh, we might be having a conference. Are you interested?" I said, "Absolutely." Now, the why of it is, and I don't want to sound kind of sad about this, but it's hard to find people who are like-minded in my profession.
Mm-hmm.
And when I realized that, wait a minute, there's a whole world of people out there. There must be like thousands of people who are thinking at least somewhat along the pathway that I'm thinking. Doesn't have to be the same, but just so that we can have a conversation like this.
Mm.
So they're not wincing every time I say the word compassion or empathy or kindness in this, or soul, in the same conversation about talking about healthcare delivery.
Mm.
When I realized, oh my gosh, there's all these people and we can collaborate and share this message that what makes healthcare much, much more palatable for our clients, but also for us, is that when we experience joy and pleasure and the power of being able to be with someone and watch them, not because of us, but with us, get
Mhm.
better and healthy. So powerful.
I mean, I think that's so much of what you've said is also why I'm wanting to be there, just really wanting to connect with and collaborate with and get to know and hear about all the different ways that people are working in this sort of space where we can come together and create a bit of a movement. Well, it's already started, hasn't it? But I just think, particularly for me, I'm a music therapist, which is a very small profession. And then I'm on the island on the bottom of Australia. And just to find people who are passionate about this area as well. I'm really excited to meet people like yourself and like so many other people similar to yours. I wasn't really on social media before 2020, and now, it's just so much of the way that we can connect and share ideas and come together in this space, which is really exciting.
I'm a bit lucky because my mum was one of Canada's first art therapists
Oh.
for mental health care. And so she was one of the pioneers in Canada bringing art therapy before there was any kind of designations in that area. She just kind of started working at a local mental health facility. But I thought, wow, it's what she's doing is really important and powerful. I could see evidence of what she was doing was helpful. I was only a teenager at the time, but I could see it. I could see what was
Mm.
happening. And I thought there has to be a way to marry the arts and what we're doing as healthcare workers. And that's why when I became a professional, it's not lost on me that we can use these other modalities very effectively. So if someone's had a stroke, for example, and they've lost their words in their
Mm.
left, with music and words, that connect to the right brain, they can repopulate their words again.
I
And
know,
so
it's amazing.
so this is a direct example of using science and music is basically math in many ways, but using it to not just for health reasons, but to exemplify someone's competence and capabilities.
Mm. Hmm.
When we can have hope for what we're doing, it can really help with compassion. And I'm guessing, and I want to ask you, is your interest in helping the helpers got something to do with helping them with compassion fatigue?
Oh, I mean, that's part of it. I think it's so much of it is to do with, we either get caught in detachment and tuning out, or at the other end, just completely frying ourselves in that sympathetic way. So, but when we're heading towards either of those, if we don't have that sort of level of collective care and colleagues around us to support us, or families or friends or communities to support us, uh, to make changes, we don't necessarily know that we're going there. But something like music and the arts and different somatic practices can help to really bring us out of that, because it can speak directly to those parts of the brain and help to bring us into a different place, or help to soothe us in different ways, or support us, or contain us, or, you know, enable us to restore ourselves in different ways. So I think it's all of that. And in terms of empathy, compassion, you know, moral distress, understanding how we can find different ways to support ourselves that take us out of that more left brain and into the right brain, and into more connection with our experience, so that we can just be, or find different ways to address what's going on for us when we're so, you know, I mean, you know how under-resourced all of the systems are that we work in healthcare and community services all over the place. It's actually essential, I think, to have these different ways of supporting ourselves and each other that do bring joy, that do build resilience, that do, you know, build a capacity for that kind of moral courage that we need in this sort of space. And I really think that music and the arts, and sort of merging what we know about the neuroscience and coming together in community and connection, the connection with ourselves, connection with each other, connection to the places that we're in, is really at the heart of it.
That sounds really powerful, Minky. And I think that when I hear you talk about this, I also hear dedication and passion in the way you're describing it. And I think that that's something that's never lost on me, because I think, and this is my opinion, that we need to be role models for what we're trying to do. And if I get on with a client, oh my gosh, like, how are you doing today? It's, we have to be role models for what we're trying to
Yeah.
do.
Mm-hmm.
In other words, we look like we're burnt out. We look like we're overstressed. We look like our cortisol levels are above our head somewhere and we're drowning. That's not the best exemplification of what we're actually trying to role model. And I think when we look after our self-care, and that
Mm-hmm.
becomes very important, and for me, I call it non-negotiable, and that's total self-care, not just going out for a jog or something. I think that that's something that certainly my clients pick up on,
Mm.
because they know that I'm also trying to exemplify to them what I'm doing for myself.
Mm. Well, I think Vicky Reynolds talks about it in terms of we have to be the bringers of hope, because if we
Right.
can't bring the hope, then what are we doing?
Well, I think that's what we are doing. I think that's
Mm,
why I'm so drawn to this conference, because
mm,
if we have all of us getting together and in our own way sharing a message that somehow becomes an orchestra of information, not just when they're tuning up and it's dissonance, but when they're now orchestrating that and creating that something, it becomes one somehow.
mm-hmm.
And so if we can do that at this conference, and I'm very sure we would achieve something quite new
Yeah, I think so.
and bold and
Mm,
powerful at the
mm,
same time.
mm,
Yeah, and I found it very difficult. I've worked in isolation for decades, really,
mm,
and these last 5 years is, oh my gosh, like, what are the chances of me meeting you in any other way than us having this connection, this connection, this connection, and now we're having a conversation,
mm,
and
mm.
next year we'll be collaborating. So I think this is the magic.
Yeah, it is. It's exciting to think about coming together. And I think it's what's exciting for me about the conference as well is just thinking about, sometimes it can feel like, even though I know people are doing the work around the world and around the country, in my immediate sphere, nobody's really got the similar focus. So it's pretty exciting to think that we can come together, because sometimes I can feel a bit isolated in what I'm doing as well. So the thought of meeting with yourself and Cherie and so many other people who have a similar focus, but from a really lots of different ways, is pretty exciting to come together. And I know that Cherie's spoken about wanting, you know, not necessarily wanting it to be a conference as such, but some sort of coming together in community and connection, or festival or something that is something new and exciting and very much community and connection based, which I think is what I'm
Well,
really
for
looking
me,
forward to.
for me, Minky, I don't mean to interrupt you, but for
Mm,
me, the emphasis is on supporting.
mm,
and really supporting. I mean, that Sherry already has a huge platform on helping doctors with burnout, and I've I've written on burnout and talked on burnout, and one of the big roadblocks, and I'd be very interested in what you say about this. One of the big roadblocks is shame.
Mm.
So we can
Yeah.
say, do all these things and you're going to feel better, but a lot of people don't want to admit that they're struggling because, especially in healthcare and training, especially in medical school, you never said you were struggling. You never said you found something too difficult. You never shared anything personal or private, because the minute you're that person, people you feel like you're being treated like a pariah. So if you had a problem, you kind of kept quiet about it and just
Mm.
hoped it would go away. And of course,
Mm.
they don't go away. They accumulate and it weighs you down.
Yeah. Yeah. I mean, I think that there's so many levels of shame. So there's that sort of more obvious level of shame where you, particularly for doctors, it's been the case that you can't, just for the sake of the promotion of your career or going to where you want to go to, that you traditionally or historically haven't been able to talk about that. But then I think, just even thinking about cultures of shame in our society and cultures of shame within us that go back, and then we could keep looking deeper and deeper, couldn't we, in terms of uh, what's brought us to this work, and what are the messages that we've received, and how we've kind of formed ourselves around those, and therefore it's essential to talk about shame, I think, because it's so much a part of this, at many different levels. And I think sometimes it's also part of why it can be hard to step out and see it, because it's embodied in us too. And so often we know what we should do, but we can't actually take the steps to do it. So the more that we can look at and unpack the cultures of shame that we sit within, the better, I think.
I couldn't agree with you more. And I think knowledge alone is not enough. I think we have to feel it. And the problem with burnout is you stop feeling your own feelings. You numb yourself to yourself. And so you're not getting that motivation. And particularly if you're surrounded by shame, then that creates silence. And we all know how bad that can get. So that's why this conference for me is so vital.
Mm.
Because if we start having this conversation pridefully, with humility, instead of all whispering about and saying out that we have to be careful, I think that changes the conversation for our audience and also
Mm.
for healthcare workers at large. Because
Mm.
the message is that we have to be able to feel comfortable to reach out. We have to
Mm.
feel comfortable to support each other. There's no shame in being ashamed if you reach out and you can get help for it and build resilience. And we all know that people build resilience by asking for help. That's one of the ways we build it, to say, I'm not handling this. Can you help me? And if you get that help, that strengthens you.
Mm. And I think we can only really do that in a community in this way, can't we? Because, well, we know that the antidote for shame is stepping into that place of support. So starting in this way is going to be really helpful, and then seeing how we can create ways to make that more possible beyond is going to be helpful as well.
I think it's going to be hopeful and helpful, and
Mm.
it's going to change me as a person,
Mm.
because I've been waiting for an event like this for almost 40 years.
Yeah.
Meet my colleagues, who I don't have to explain something and say, don't you get it? Like, empathy is
Mm.
important. Passion's
Mm.
important. We
Mm.
are doing this because we're helping people, not just eradicating diseases or to, yes, we want to stop suffering, but we want to elevate the person as well.
Mm. So, have you been to Uluru before? Have you been to Australia before?
There's a slight chance I might be going this year and a
Oh.
definite chance I'm going next year. So
Mm-hmm.
if I go this year, I'll reach out and see who I can see. But my daughter lives in Italy and she's got a conference there, so I might be hopping on board with her. And if not, I'll definitely be, no, never been to Australia. My
Mm-hmm.
wife is from Malaysia, so we go to Malaysia a lot. And I've always said, why don't we just skip over to Australia? It's just there, five
Yeah.
hours flight, something like that. But we've never done that. But we will now.